Good morning and happy Saturday, you guys. It is Amanda and Barron from Kicking Cancer Cares on KSLM Radio, 104.3 FM and 1220 AM. Our sponsor for this first half, stay.
The microphone's not cooperating with you.
Is Oddmo's Pizza, and they have amazing food, you guys. Any type of pizza you could possibly think of. They've got all of the amazing options with baseball themes, which is really fun.
Yeah.
And they've got appetizers that are so good. I can't get over their potato poppers.
That's your favorite.
And they're baked. They're not deep fried. So I love that about him. He's got vegan cheese options. He's got gluten-free options. He caters to all of us. So I absolutely love that about Mike from Oddmo's.
I am not sure we can get many more people in this room today. We got a room full today.
We do.
So,
go ahead.
Well, I want to introduce a returning guest. Dr. Isaksen is back for the third or fourth time.
Yes.
But we have a special guest with us, and I'll let you introduce yourself, Elana.
Elana Emlin. I'm from Portland.
And you are with the Northwest Sarcoma Society.
Yes, I'm on the board of the Northwest Sarcoma Foundation and an active volunteer.
All right.
So that's going to be kind of the heart of our discussion today. It's
Perfect.
also why we are wearing yellow.
Okay.
So
awesome.
We'll get deeper into that. But last week's show has already gotten a lot of feedback. We had a guest call in from Texas.
Oh, yes.
From Junction, Texas.
Yes.
And his company has developed an amazing product. What are your memories about that conversation?
I think just how he's got this technology that basically takes all of the nutrients, and instead of us getting a small portion, he's got something that he puts in his products that...
Biomax.
What was it?
Biomax.
Biomax, yes. That helps us absorb it and get all of the good things that we need into our body. And so that one stuck out to me.
Yeah, well, I've already connected with a couple of people because he has this one product called C Support.
Mm-hmm.
And it is helping get stuff into the cells when you're going through cancer.
Yes.
But that was a very good conversation. And then it was really fun for us just to have some remembering of 2024.
That was really fun. Yes,
Like
a little walk down memory lane.
Yeah.
That was fun.
Well, last week I brought you the food from our magazine.
Yes, pears.
Yes. Well, this week's food is pineapples.
Oh, one of my favorites.
Guess what I have?
Pineapple.
I have pineapples for everybody. And there's plates.
Yay! He knows the way to my heart through food.
So there are pineapples for everybody today.
I'll let you guys have the plates first since you're up there.
Well, here's what the magazine says. And again, this is a Time magazine. It's a special edition, 100 disease-fighting foods. Mm-hmm. And from the magazine, it says, why are pineapples disease fighters? Inside this spiky tropical fruit is bromelain. I think I'm saying that right. A powerful enzyme that helps digestion and curbs the inflammation process.
Okay.
Inflammation is just a huge problem with all disease. In lab research, an extract of bromelain stopped breast cancer cells from progressing.
Wow. Okay.
So they just put this bromelain on breast cancer cells and it stopped them from progressing.
Okay.
Kind of a powerful little food. Reach for pineapple for a hit of vitamin C. A serving contains 131% of your recommended daily amount.
Sorry, what? Say that one part.
So your vitamin C out of pineapple, 131% of your recommended daily amount of vitamin C.
Awesome. I eat pineapple. It's stocked in our fridge, especially during spring and summertime. I have it dehydrated in my cupboards right now.
Well, if you want a good sugar hit, the dehydrator will be good. Well, of course, with Mike from Oddmo's, that's always the big debate. Does pineapple belong on pizza or does no?
Yes, it does. You've had this talk before. Yes, it does.
You ain't convincing me.
I like the sweet and savory, right?
Well, and then our update is it's less than a week away. Next Friday is the first of two Russ rock concert.
Yeah. Can I show off my rock?
Yes, this is so
camera.
fun. So I don't know if Dr. Isaksen has heard the whole story, but Russ is now on the staff. He had a spot on the bottom of his foot about 2.5 years ago. Thought it was a mole. About 2 weeks later, it had grown the size of a quarter. It was really black. He's like, this is not a mole. He goes in and gets it checked. It was, they call it malignant melanoma. Mm-hmm. So basically metastatic skin cancer. Headed up his leg. They thought they had it stopped. He figured out how to resist the treatment. It got to his lungs, and about 2 months ago, he let me know it got to his brain. So I was very concerned he wasn't going to make it till the end of 2024, but they cannot find the tumors in his brain anymore, nor they can find the tumors in his lungs.
I love that.
So he's healing.
Yes.
And we are going to have, we created this really fun shirt that says Russ Rocks as a show of support. Well, now we're having the Russ Rocks Rock Concerts. We have one here in town next Friday at the Rec. A group called Infamous Soul is going to play. And then next month on the 15th of February, it's going to be in Corvallis. And it's a group out of Monmouth called Kickstar. Well, I think this was actually your idea. That we, since it's called the Russ Rocks, everyone can have their own pet rock that says Russ. So it's the Russ. This is your own personal Russ rock.
Yep, I love it.
But Russ is about 10 grand behind on his medical bills, so we're just trying to do something as a show of support financially to help Russ out.
Absolutely.
My last interesting update for you is after we're doing, Dr. Isaksen, is we've been telling the listeners, if you hear us and you've seen the YouTube, let us know you're out there. We'd love to know where you're coming from. This lady named Sandy Glens from Miami, Florida. That pineapple got away from you. I saw that. You know that YouTube is...
anything, 'cause nobody would have seen.
No one would have said anything except for the camera's caught and you drop it.
I went tumbling. Sorry, go ahead.
So Sandy reached out from Miami, Florida.
Okay.
And she and I had about a 30-minute conversation. She loves what we're doing. So I sent Sandy one of our flyers with our sticker that looks like the state of Florida.
Yes.
So Sandy, we appreciate you listening, and we see you.
Hi, Sandy.
But I do want to dive into a very rare cancer. It's called sarcoma cancer. And there's two reasons why these two guests are here. Dr. Isaksen is a sarcoma cancer survivor.
Okay.
And unfortunately, Elana's husband did pass, but you're on the board now for the Northwest Sarcoma Society, right?
Mm-hmm. Yes.
This is how rare this is. I went, and you've got actually more recent numbers, but what I found from the American Cancer Society is there's 13,000 new cases a year.
Wow.
That's pretty rare.
Yeah.
And 80% of those are soft tissue cancers, and about 20% are bone cancers.
Okay.
So when we say soft tissue, it typically shows up in the muscle, in fat, in blood vessels, in nerves, in tendons, and joints. Mm-hmm. I'm going to let both of you kind of elaborate on this. So what do you have information for us? What do you have?
Well, you're exactly right that it can show up anywhere, and I've been calling it the anywhere cancer you might never have heard of because it is so rare. It's only 1% of all cancers that are diagnosed each year are sarcoma. So it's rare enough that people are like, huh? Never heard of it.
Right.
And then the fact that it truly can show up anywhere. Deep inside the body, on arms and legs. It's very common on arms and legs. So it's really something to be aware of and look out for.
Yeah.
Well, and a really good example is one of the big sponsors for us here in town is With No Motors. Mm-hmm. They've been a sponsor with us for several years now for a lot of our golf tournaments.
Right.
And when I went over this last year to thank them for all of their efforts, Justin, who manages the location on Mission Street, he said his aunt had just been diagnosed with angiosarcoma.
Okay.
Mm-hmm.
Had looked that up.
Yeah.
It's in your blood vessels, except for her, it's the blood vessels that lead into her heart.
Oh, no.
Which makes treatment even
harder. Yeah.
So typically, you get, like Dr. Execdir says, so well, you cut the cancer out, you burn the cancer out, you poison the cancer out. Well, you're not going to cut it out.
No.
And you're not going to burn it out. So they're trying chemotherapy. And in his aunt's case, the problem is the chemotherapy is reacting to her body, and so she's become schizophrenic.
Oh, gosh.
Like she's hearing really weird voices, she's having weird reactions. So like, we got to get you off this chemotherapy because of what it's doing to her body. So they're in a really weird position as to how do you treat the cancer.
Yeah.
But for someone who's gone through this, Dr. Edson, what are your thoughts on sarcoma cancers? I know you have tons of thoughts on this.
Lots of thoughts. Sarcoma is just like you said, it's less than 1%. Not a lot of people have heard of it or know about it, know how it's different than normal cancers. And a lot of doctors don't often know how to treat it because it is kind of rare. And due to that, depending on where it shows up, can drastically affect how treatment goes. I was very blessed. My cancer was in an area that could be surgically excised, but hers, being on the heart, you can't do that. And sarcomas respond differently to chemotherapy than other cancers do. So it's one of those, because it's not so common, there's not as much research behind it and as much experience in treating it as other cancers. And so it's kind of one of those wild cards. You just never really know which way things are going to go with it.
Yeah. Again, just based upon the American Cancer Society's website, the survival rate, if it's only surgery, is 20%. Meet 20%.
Okay.
If you do the surgery and then you add the chemo and the radiation, survival is about 50%. So it's not like a phenomenal success rate when it comes to survival, even from what their website has to say. It's been a while since you've told your story, Dr. Isaacson, and we've got some time. Can you? What were the signs? What were the symptoms? What were the treatment on your cancer case?
So first sign that I noticed was a lump, and it was deep in the tissue, and I didn't think it was anything because it was small, about the size of a marble, maybe a little smaller than that. Wasn't painful, wasn't moving or anything, it was just there. Honestly, I'd fallen several weeks before, and I figured it was a muscle that had just knotted up and wouldn't let go. And I literally had massage therapists trying to break it up because we thought it was a muscle knot.
Mm-hmm.
Except where was it?
It was deep in my gluteus maximus.
Okay.
Yes. So.
Yes.
Oh, that's painful though, like trying to work that out.
Yeah.
Oh,
Yep. So that was interesting. We tried for quite a while, but it didn't change. It was just there, and so for a long time I just ignored it because it didn't bother me most of the time. And then one day it started growing. And it went from that little smaller than a marble size up to golf ball really quickly. Within 6 months, it went from smaller than a marble to almost as big as a baseball.
Do you think it was growing because you were poking and prodding at it without even realizing it?
Nope, because I had done that before and stopped. Honestly, what I think caused it, and then what I think caused it to grow, was my cell phone. It was because I always put my cell phone in my pocket. And initially it was flip phone because this was way back,
Yeah.
And flip phone radiation is minimal compared to a smartphone. And so I had that little marble size nodule, had there for many years. And then when I switched from a flip phone to a smartphone is when it started to grow.
No way.
And I didn't realize until later when I correlated the timeline, I thought, wait a minute, that started in a little nodule about the time shortly after I got a flip phone, and it started growing when I switched to a smartphone. And the radiation coming off smartphone is like 100 times more than a flip phone.
Yeah.
So it correlated perfectly, location and timing with cell phone usage.
Okay.
That doesn't mean that everybody who has a cell phone is going to get a tumor, not going to get a sarcoma, but some people are more prone for it than others. I had a grandfather who died of bone cancer, and so I'm genetically more prone for cancers than others. And I'm convinced that it was the radiation coming off the cell phone that caused it, and then caused it to grow when I switched to a smartphone.
Yeah.
So the cell phone is never in my pocket, ever.
Ever.
Anymore.
Yeah.
No.
Okay.
Well, and you said something a minute ago I think is so valuable. There's a lot of things to talk about in the show that we can show a correlation. Can we prove causation? No. But as far as you're concerned, there's in his mind, there's enough causation that doesn't go in your pocket anymore now. Mm-hmm. And again, like you said, we're not telling people that don't be freaking out about your cell phone, but cell phones do emit radiation.
You should.
They do.
Yeah.
I mean, I've made this comment several times that there's a lot of young ladies in their 20s that think that this little area right here is a pocket.
Yes.
And so they put their cell phone between their breast and their bra. Mm-hmm. And so that's right on that breast tissue. Breast cancer cases aren't going down. So whether we can prove causation doesn't matter. At least be aware of what you're doing.
Yeah.
So, So in your case, they were able to catch it and then surgically remove it?
Yes. So when it started growing, I immediately went to my doctor, asked for testing to see what it was. Then we did an MRI. The MRI did not look good. Went to a oncologist who did a biopsy. Biopsy came back positive for cancer. Mm-hmm. And so we were in surgery less than a month later and surgically excised it. I was very blessed. He said all the margins were clear, meaning he took a bunch of extra tissue, which means now when I sit, I lean to the left. But
got an uneven rump.
A little bit. I had a pain in the rear, but I don't anymore. So yeah, surgically excised. They recommended that I do radiation afterwards. I prayed about it, decided it wasn't for me, chose not to, but had continual follow-ups for multiple years afterwards, and I'm now over 10 years free and clear.
Oh, wow.
So,
Okay,
Wow.
that's awesome. Yeah,
10
that's
years.
awesome.
So he is part of that 20%.
That's huge. Yeah, okay.
Yeah. So what's really intriguing with this whole story, and I know that I'm pretty sure that he'll remember this, we were going to do our very first seminar. Brenda was going to fly up. We're doing that very first Warrior Dash. And I thought we could just get a few people together so Brenda could share her story. But there was going to be a little bit of cost to put the whole thing together. Well, he's been my chiropractor for a number of years. So I said, would you be open to helping sponsor this? And so we met at the Denny's where Costco used to be. And we're sitting right there together. And he says, I don't remember the exact words, but basically, there's a reason why I want to help you. I'm like, okay, why? And that's when he told me he was a cancer survivor.
Okay.
So
Full
he
circle.
has been with this cause from day one.
Yeah.
And then it would have been, we'd done that first Warrior Dash, and all of a sudden I had these leftover T-shirts that I wasn't selling. And I thought, well, I'll be back trying to sell some shirts. And at the time, you were the chair of the greeters with the Salem Chamber. And he said, if you want to do anything in this town, the greeters is a really valuable place to go because you're going to meet a lot of people. So I walk into my very first chamber event. It was at Northern Lights. I vividly remember being scared, nervous. I don't know anybody. And the first person that saw me was Faye DeMeyer.
Oh, I love that.
And
Because
she
she's
just,
so open
and,
arms.
you know, and she just says, oh, here, come sit by me. And of course, he's busy because he's conducted the whole thing. But about 2 months later, another friend, Chris Fondrick, said, if you want to do what you're trying to do, you really need to be a nonprofit. You need to be a 501c3.
Yeah.
And I knew that I needed at least 5 to be on the board. And he says, I'll be on the board, but you got to find some more people. Well, Faye said yes immediately. And so did Dr. Isaksen.
Okay.
So he was on our founding board of directors
That's
for
cool.
a while. Yeah.
That's awesome.
Because they, Faye had already beaten cancer once. And Dr.
Did
Isaksen-
she? I didn't know that.
Yeah. She had already beaten uterine cancer.
I didn't know that.
Yeah. So she, and on top of the fact that she likes to be part of these causes.
Yeah,
right?
yeah.
But who would have thought when we all signed our names to that document years ago that this cause would have gotten to be as big as it is
Yes. I love that, though.
now? So, yeah. So he's been really involved. He's done a number of workshops for us. We did a really fun one in your office when you were, we had a group of people sitting there, and he shared some stuff in the office too.
That's cool.
One thing you shared, and we have some time here that we can kind of circle back, but I remember you talking about exercise, and you shared an example about a study that was done with people with diabetes, and I think it would be very valuable to our listeners to hear this study. You remember what I'm talking about?
Yep. So they took a large group of type 2 diabetics and divided into 3 groups. They wanted a control group. So the control group did nothing. They just did the normal thing. Second group, they did the standard Western medicine recognized diet and exercise. So not diet, exercise. They did 30 to 45 minutes of aerobic exercise 3 to 5 times a week and did that for 6 months. And prior to doing this, they did baseline A1C and resting blood glucose and a couple other tests, so they get a baseline on everybody. And then the third group, they had them do high intensity but low duration exercise. So as high as you can go in intensity, but for only 1 minute at a time. And
Okay.
do that 3 times a week for 6 months. At the end of 6 months, they brought back all 3 groups: the control group, which didn't change anything, the standard, 30 to 45 minutes of aerobic activity, and then the high intensity for 1 minute. And they retested all those same exact markers. And of course, the control group, there was no change. That's, they didn't do
Typical.
anything. So no change. The group that did 30 to 45 minutes of aerobic activity 3 to 5 times a week for 6 months absolutely had improvement in all their markers. It was, depending on which markers you looked at, anywhere from 12% up to about 18% improvement.
Oh,
so
wow.
an average about 15% improvement
Yeah.
in A1C and resting blood glucose and all the different things. And then the last group that had done just 1 minute of high-intensity exercise 3 times a week for 6 months, which, mind you, total duration of exercise time, in the 6 months they did less exercise than the second group did in the first week.
Oh, my.
I know.
You're doing 1 minute,
1 minute.
Right.
3 times a week.
So
Easy.
3 minutes of workout a week over 6 months' time. And at the end, their change, they had actually changed their A1C and the resting blood glucose and everything else, but it had nearly doubled in improvement over the group that did 30 to 45 minutes of aerobic activity 3 to 5 times a week. It's huge. There's something about high-intensity exercise that causes our metabolism and our cells' ability to break down and utilize different materials, changes it drastically. Aerobic activity is good. There's nothing wrong with that. But that high intensity is absolutely miraculous. And that stemmed a whole new tide of exercise called HIIT, high intensity interval training.
Okay.
That's all based on that one study, high intensity. So there's something about high intensity that really affects the body.
Yeah. Okay.
So ever since I heard that, what I'll do, like if I go to the gym, I'll do my little routine, weightlifting or whatever I do, but I always end it the same way. I go to the stair stepper, and I'll find a nice rhythm, whatever that, level 4 or 5, whatever that level is for a nice rhythm, and I'll do that rhythm for 1 minute.
Okay.
And then I'll go as fast as I can physically go for 1 minute.
Okay.
And I'll tell you what, 1 minute as fast as you can physically go.
Probably feels like 30 minutes.
Oh, and you're going, there's 3 seconds left, 2 seconds left, and your heart rate's going like crazy.
Yeah.
But just knowing that, but I also thought the analogy you gave as to why that is so valuable, when you think about our ancestors, so this is an interesting analogy too.
So whether you're a creationist or a Big Bang theorist, our ancestors were agrarian for a little while, but before that they ran away from prey. Whether that was a lion, a tiger, whatever it was, or they were chasing after prey. If that was a buffalo or an elephant or whatever it was, they were either running from prey, from predators, or they're running after prey. Mm-hmm. We think about it, they didn't go out and jog for 30 minutes at a time to go after whatever it was.
Right.
It was a hard, fast sprint as quick as you could to get that prey or to get away from that tiger or whatever it was. Mm-hmm. Short bursts of high intensity was what they typically did. And they didn't sit down and eat 3 meals a day. They wandered around, they scrounged for berries and roots or whatever it was, and then when they found something they could eat, it was a hard dash for it, and then they were done. So short bursts of high intensity is what our ancestors did. So theoretically, short bursts of high intensity is what our bodies are designed for, not 3 hours straight of running at 120 beats per second heart rate, whatever. Our bodies seem to be designed for short bursts of high intensity instead of long duration, medium intensity exercise.
Yeah. Okay.
And I find it interesting when I go to the gym now, and especially now with the changes in technology, I'll see this person on a treadmill, and they're going, but not very fast.
They're
And the whole time they're like this. I'm like, so you think you're exercising? But you're scrolling through your phone on the treadmill, and then they look at me on my stair stepper, and I'm like, I am just out of
you
breath.
Just got here.
But that HIIT is, ever since he told me that study, I'm like, I don't know if it works, but I am not opposed to trying it out.
Yeah, absolutely.
I actually had one patient who did this. She was roughly 5'2" and about 320 pounds when she started. 6 months later, she was still 5'2", but about 180 pounds.
Wow.
In 6 months' time.
140 pounds.
And most of that was she did high intensity 1 minute 2 times a day for 6 days a week. She really wanted to make sure this worked. But she also cut back a lot on the carbs and the sugars and was focusing more on meats and vegetables. But the combination of those two, she lost over 100 pounds in 6 months.
I was just going to say, throw in some dieting into that, and that's a good combo.
Miraculous change for her.
That's awesome. That's cool.
Anyway, I just want to make sure that I wanted to revisit Dr. Isakson's story, but just his knowledge about our body and how our bodies function, I thought was really, really valuable.
So would screaming at my teenagers for a solid minute work?
That was
asking for all moms out there.
It does qualify as high intensity.
Different kind of intensity.
The T-Rex mom just coming out.
Figured I'd ask. Sure other moms were wondering. Because otherwise we get our exercise all the time.
Yeah.
No, I'm just kidding.
Yeah. So I don't know how we're doing on time, Amanda.
We've got about a minute and a half.
So I want to give you, in our last minute and a half, I want to give you a really interesting analogy, and it kind of ties back into the cell phone we referenced earlier. But we've used this phrase so many times, correlation and causation. Mm-hmm. Okay? And this is an actual study that was done that creates correlation.
Okay.
Okay? And they did 2 exact studies. I'm gonna send this graph to Ashlie. So if you have not gone to Kickin'Cancer Productions on YouTube, please go so you can see the graph.
Hello.
They showed the exact same curvature when you increased your ice cream intake as shark attacks.
Oh.
So if you look at these 2 graphs, they are exactly the same graph as to how much ice cream you eat and how many shark attacks occur.
Okay.
Now, does that mean that if you eat ice cream, you get attacked by a shark? No. There's no causation here. There's a correlation. Okay?
Yeah.
And by the graph, it's the exact same correlation.
Mm-hmm.
Now, the one thing that might be a contributing factor is when the heat goes up, you eat more ice cream and you go in the ocean more often.
Okay. Yeah, fair.
Right?
Mm-hmm.
But I just want to make there's a point here that there's a lot of things we talk about in this show that there's a correlation that can be created.
Yes.
And there's a correlation between ice cream intake and shark attacks. It doesn't mean that if you eat ice cream, you get attacked by a shark.
No.
You know, but it's a very interesting chart and correlation causation.
Absolutely. Well, thank you for that.
But what I do know is eat pineapples on your pizzas.
Yeah. No. Eat your pineapple. End it there. But if you do like pineapple on your pizza, then Oddmo's is your go-to because their pizza is phenomenal. Their wings are amazing. Their potato poppers, everything's amazing. So thank you, Oddmo's, for sponsoring our first half. We'll be right back.